What's up, guys? All right, I am Dr. Chris Park. I am a family physician and addiction doctor, and this is not medical advice. All right, so the good news is you're pregnant. Bad news is you're not sure what you need to do. Okay, so maybe you're struggling with addiction to pain pills. Maybe you're struggling with heroin addiction. Maybe you have been clean for 2 years and you're on Suboxone and now you're pregnant. What do you do? Okay. So typically, the advice is almost always the same in each group. Okay? Get treatment, stay clean, prevent withdrawal. Right? Okay. So now I'm going to be speaking a lot in generalities, just kind of basic recommendations and kind of what the way I approach it. But obviously everybody is a little different, okay? And your care needs to be coordinated with your doctor, your OB, your addiction doctor, your family doctor, or the baby's pediatrician, whatever. Your care needs to be coordinated and individualized to you, okay? Because these things I say may not apply. I don't know your whole case. I don't know your complete history, but for the most part, we consider like methadone and buprenorphine gold standard of care if someone is suffering from an opiate addiction. And so we use these medications to help people through pregnancy, okay? Now, it's not without its risks, right? So the good news is, so far, at least from the studies I've seen, there hasn't been really any reported birth defects from taking Subutex or buprenorphine. Okay, but it can. One of the things that can be a problem is after the baby's born, they can have a condition called neonatal abstinence syndrome, and it's basically withdrawal in an infant, and it can be pretty severe. And sometimes we have to put these babies in the neonatal intensive care unit even and give them morphine to prevent withdrawal and severe side effects. So, but the thing is, man, you kind of, I'm talking to women and I just said man. Anyway, sorry. The thing is, you're between a rock and a hard place, but in a good way, right? Because you're pregnant, so congratulations. But in a perfect world, you wouldn't struggle with opiate addiction and you wouldn't be on medication. But we're not dealing with those circumstances, right? So we've got to make the best decisions we can with what we've got, right? So just go ahead and embrace that now, because I know you're gonna beat up on yourself, and you're gonna have a lot of self-guilt and self-loathing. Well, guess what? That's not gonna help you, and that's not gonna help your baby, and it's not gonna help your pregnancy. So forget that. Instead, let's focus on what we can do now to make everything as good as possible, okay? And I'll tell you, it's typically not recommended. Like, let's say you're already on medication, okay? It's typically not recommended to taper off during pregnancy, because with going through withdrawal can cause preterm labor and other issues with the baby. And obviously, relapsing is so much more dangerous for the baby and you than staying on medication. So most folks stay on medication. They also, again, from my understanding, there's no link to the dose buprenorphine you're on and the amount of neonatal abstinence syndrome. So it's sort of like they'll have it or not. So there may not be any benefit from trying to taper down to a really low dose, right? Especially if it puts you at risk for withdrawal. You don't want mild withdrawal. The goal is you want to try to have a stable environment internally and externally for you and your baby, okay? So we will typically, if somebody's already clean, we'll just keep them on meds, all right? Now, if you're on Suboxone, you might get changed over to Subutex. Subutex being just the generic buprenorphine, no naloxone in it. And but nowadays, that it's starting to be thought that maybe folks can just stay on their Suboxone. It probably doesn't cause any issues with the baby either, other than that, possible neonatal abstinence syndrome. So if you're not on medication, it's it's recommended that you do get on medication, because that risk to you and to your baby when you're snorting pills or shooting up, or just zonked out, after swallowing 40 milligrams, 100 milligrams, oxycodone, whatever, that is a much higher risk. And the thing is, and I guess I'm going back to this, you've got to start to, and you will, like, if you're pregnant, then you're not just, thinking about, more than likely, you're not just thinking about getting high anymore. Now you're actually contemplating some serious life situations, because probably your drug use in the past, you thought it just affected you, and now you're awake to that realization that there's more to this life than just that. And if you're watching this video, you know that. So I'm preaching to the choir. But so get rid of that self-hate and the self-loathing, and just make the best of the situation you have. And that's probably going to be medication for opiate use. Okay? So in other words, you're probably going to need to be on Subutex. Okay? Methadone is fine too. It's still considered kind of, I guess it's still considered the gold standard, but I prefer buprenorphine. I think it's better. But again, so this is just a conversation for you to have with your OB. This is not medical advice for you. I don't know enough of your history. I can't give you blanket statements. I can just kind of tell you some general thinking, and you can go do your own research, talk to your addiction doctor, and y'all come up with a plan, and you just love that baby, and things are going to be all right. Okay? All right. Peace.